Okay, we're live.
All right, great. Thank you. Welcome to the March 16th meeting of the Community Services Committee. I'll start out by we're looking at the roll. We have myself, Chair. We have Councilperson Nicole Ayers, Councilperson Brian Meek, and Councilperson Barbara Smith in attendance right now. And we can get started. So we'll begin with public comment. Do we have anyone waiting to speak in the attendees?
Yes, sir. Good evening, Chair. We do have someone, Diane Laricella. I will promote her to panelist to speak.
Great. Diane, go ahead and unmute, and you can have 3 minutes.
Thank you, Chair and members of the committee, as well as staff. My name is Diane Laricella. I live at 21 Little Fox Lane. There is no doubt that this committee is doing really important work, very important work on all the things you'll hear about today and in the past. I'm here tonight just because there are two issues that, a handful, but I'm going to focus on two issues for tonight. And I'd like to find out after the meeting, hear from somebody about these issues. The first is artificial turf fields. Currently, the city has 3 artificial turf fields in the pipeline for design and construction. The most recent will be at Broad River. I asked, and I did send an email to, the reason I'm here tonight is because I did send an email to Health Director Deanna D'Amore. She's giving a report tonight. I, of course, don't know what all the items are. So I asked, because I have not heard back from anyone about this issue, and it has been something I've been speaking about for several years, including Health Director D'Amore, and I do think it is in their purview. The second issue is the ongoing item relating to COVID messaging. I am often indoors and one of the few that still is wearing a mask by choice. But I ask friends, why are you no longer using the tools that we were taught years ago, considering the variants are even more, they're even more contagious? And they say that they haven't heard from government anymore. There are no signs on StopRite, Stop and Shop, even City Hall as to just doing what the state health director said only this winter, and that is strongly suggested that indoors, while it's still cold out, that you wear a mask. And I've just been very disappointed. And I have a paper trail. I've appeared at Board of Health meetings and meetings with your predecessor, just to state that the messaging needs, just like the staff, I'm sure, had been very exhausted. It was a long haul, and they mostly did a great job during the 3 years. The public also is exhausted, so you have to use new ways of messaging and communicating to the public, not the same old, and not just the city website on an occasional game that was, I guess, put together by the staff. You really have to use pictures, make sure people who don't speak English as well also are included. And I just don't see it. And I'm in the environmental health business. So once again, I look forward to listening to the report of the health director, as well as this committee. Thank you for your time.
And thank you, Diane, for your comments. Do we have anyone else from the public that's waiting to speak?
No, sir. This concludes those that are on my list.
Okay. Give me a second. Diana just emailed me for the link. Could you email her the link again? Is that possible, Lamond?
I'll do it.
Or thank you, Nicole. Appreciate that.
Thank you.
Sorry, I'm trying to multitask here. Second. So moving on in the agenda, approval of the minutes from the meeting held January 19th, 2023. Can I have a motion? Thank you, Councilperson Smith. And do we have any changes, deletions, amendations? Anyone from the committee? No, all right, I've got a couple just really quickly on page. The third page, I think it is, where it's under the motion pass discussion number 4. The 3 paragraphs down, it says Dr. Meeks, and that should be Dr. Weeks. There.
And you
then-
could change, oh, sorry to interject. I mean, it's just Brian Weeks or Mr. Weeks.
Okay, then we should change all the doctors to Mr., is that correct?
Correct.
All right, so if we can make that change. And then in the second to the last paragraph, it starts with Mr. Daniels announced bringing on the new, that should be DEI chief, not DEAI, is that correct? I think it's just DEI, right? And in the next paragraph, if you could say Mr. Meeks asked, add the word asked if the department budgets were submitted. And on the last page of the minutes where it says motion passed with 1 vote in opposition, it was Ms. Alterman who was the no vote there. It was not Ms. Ayers. So thank you. We can make those changes. So accepting, we'd like to vote on accepting the minutes as amended. All in favor, signify by raising your hands. Opposed? Any abstentions? And Diana, are you in favor of the minutes?
I was just going to say in favor, couldn't find the button.
Oh, okay, no problem. So motion passes unanimously, the acceptance of the minutes. All right. If we can move on to item 4, discussion. We're going to get updates from the health department. So I turn it over to Deanna Diamore.
Great, thank you so much, Chair. So I'm going to give a few brief updates. I just want to start. Brian's going to be able to give his update on surveillance and where we are, but it's really good news. We're in a much different place than we were 3 years ago when this all began. And that's in large part because of, everything that everyone's been doing and where we are with in the pandemic. So just wanted to point that out and preview that there's good news to share. So Brian will be giving his update very shortly. I have a few updates to share related to other areas in the health department. Our food inspectors have been really busy with transitioning to the new FDA model food code. So for years, we've been utilizing state statutes, specific statutes for our food protection program. And they've recently adopted these federal standards. And so we've been working very closely with the state health department on making these changes. It's a complete change to the way our inspectors are doing food inspections. And we're also recognizing that this is an educational opportunity and it's a transition period for the establishments themselves. And so our inspectors are working hard to make these changes. And then in the months ahead, we're going to be working with the food establishments on getting them to be comfortable with this and understand any of the new requirements they have. In the past, we've had a point inspection system, and this is no longer going to be the case. So we're also going to be needing to look at, we had our Lighthouse Award program and recognizing establishments for really great food handling practices and safe food practices. So we're also going to be looking into that as well. How can we evolve that program and adapt it to these new standards? We also have been, Darlene's on the call, she's our supervisor of clinical services. She's been working really closely with the public schools and the federally qualified health centers. And we're looking at increasing availability for opportunities for childhood immunization appointments within the community. So I just want to thank my staff for all that they're doing to create more opportunities and have more availability so that those who need to, catch up to their immunizations are able to do so. The last thing I just want to share is that we were accepted into, it's called the Strategic Scholars Program. The National Network of Public Health Institutes puts out this program where a limited number of cohorts of teams from across the country are chosen to participate. And We actually got selected back in 2020, but for other reasons, we were busy dealing with the pandemic, so we could not have the time to really focus on it. So we're happy to kind of have this redo and the opportunity to participate in this. And so what it is, it's focused on resource management. There's lots of trainings related to budget, financial management, procurement, contracts. We're going to be working with a consultant on a specific project. So we get access to a lot of trainings and in person and virtual, all for free, no cost. So, whenever we have these opportunities, we like to look for these national programs or these areas where, we get to learn from others across the country and we get to do it for free. So that's been great too. So I just want to thank my staff for participating in that. And those are my updates. And if it's okay with you, I'll pass it on to Brian to give his updates.
Yeah, that sounds great. I just want to let the record show that Councilperson Diana Revolus joined us at 7:10 and Councilperson Heidi Alterman joined us at 7:16. So go ahead, Brian.
All right. Thank you, everybody. Good evening. So I'll just jump right into it because I know time is, very short today in terms of we have a lot of different things on the agenda. So just to fly through it, this is the City of Norwalk COVID-19 Data Hub. Right now, we are in the low for Fairfield County. Again, what that means is staying up to date with the COVID-19 vaccines and following, obviously, the guidance relative to that. Still maintaining ventilation improvements. Obviously, somebody suspects or is confirmed to have COVID-19, follow the appropriate guidance and avoid exposing others, while especially they're waiting for results. And those that want to wear masks or at higher risk of getting sick, they could talk to the healthcare provider or they can just wear a face mask. Obviously, this is, as Deanna has outlined, we're now 3+ years for the City of Norwalk since our first COVID positive in terms of the pandemic. So again, I always keep saying it feels like 5 or 7 years, but it's been a long time. And so, obviously we've been through various stages of the pandemic. There's obviously been discussions and debates whether we're in an endemic stage. Barring any semantics in regards to that, we're obviously in a different situation where we do have the CDC COVID-19 community levels to guide us in terms of those prevention measures. And very fortunately, we're in the low of that 3-tiered system. So just wanted to emphasize that point. Again, there's other general guidance that we do have on this website. Jumping right into it, to the COVID-associated hospitalization patient census for the state of Connecticut. And, again, supporting that data, you can see the very continual and steady downtrend that we've experienced. And now we're actually almost near 150 overall for the state. When you keep in mind, our peak was actually 779 in January of this year. Fairfield County still remains in 3rd place relative to that at 32. So we are performing well in the sense that we're not the highest county relative to that count. But again, we're at 156, which is really great news. And then, just jumping into the wastewater monitoring for Fairfield County, as you can see, again, this is further supported by the wastewater monitoring. So again, this helps fill in that gap, as I've alluded to in the past about the at-home testing that creates a large gray area since a lot of people are opting for it. And that unfortunately means that we don't get that information to be factored in when we calculate case rates and look at that other information. So again, the COVID hospitalizations and the wastewater monitoring are one of our best guides, or 2 of our best guides in terms of knowing any kind of situation. Overall, very good. And then you can also see this kind of reflected nationally, where the majority of the country is in the low, almost about 85%. There's about 13% of counties still in the medium, and then about 1.9% in the high, notably in Maine, when you look at it from the Northeast. So I just want to mention that. And then if you zoom into Connecticut, as you can see, there still are 3 counties, New Haven, Middlesex, and Litchfield counties that are in the medium. So that is something to factor in terms of especially those counties and their residents or anybody, inside those counties interacting for whatever odd reason, work, leisure, whatever. So just wanted to mention that. And again, this is all because, currently, fortunately and unfortunately, depending on how you look at this, it's this XBB, more specifically 1.5, that's about 90% of these new cases in the most recent weeks. So again, great news that it's consistent. There's no other kind of variant or subvariant that is appearing in the picture that seems to be growing. So that's good news. We do want to still continue to keep an eye on this, but overall, as you can see from a regional perspective for the nation, you can see how pretty much XBB is running the show regionally everywhere, Eastern Seaboard, but also now the West Coast, where it's definitely even more so than 75% for those areas. But, they'll continue to keep growing as evident with the kind of what we've seen here in the Northeast. We're just usually kind of the first ones to experience it. And then very quickly, influenza, kind of same story. It's low, but again, for especially, for Connecticut, but as you can see, New York City still is a little bit in the moderate to high activity, DC as well. and including some parts of, obviously Puerto Rico, California, and the Southwest. So just wanted to mention that. And then real quickly, in terms of hospitalizations, one thing I did want to note, even though weather, some strangely all over the place, but, today was a nicer day. In the hospitalizations for flu, it has been obviously very low. But the catch here is we have a couple of cases relative to type B, the seasonal influenza. So important thing to note, I've mentioned this in prior meetings, type A is usually the one that presents firstly, and it's usually H3N2 for those that are subtypes. But type B is seemingly entering the picture now. So this is usually like the second wave of influenza that we do experience. Whether to what degree, it's probably going to be low just because of what we're currently experiencing right now, but it's something still to keep an eye on. As these things play out. So definitely keep you in the loop about that. But I just want to mention that. And then also in terms of RSV, that has remained low in terms of almost baseline levels compared to the historical highs we had back in late prior year. So it's good news to kind of see. And then so this is showing it now for Connecticut. So same pattern as the national pattern. So that is the update. And one final thing, actually, sorry, because I'm trying to move quickly here. The COVID.gov, this is still accessible. We still have resources here in terms of masks, test to treat, the locator there, access to vaccines, and where people can find them. And then also in terms of ordering the 4 at-home tests that individuals can do, very easy to do. Just click on the link, again, COVID.gov. And that's very quickly my update. Thank you.
Great. Thank you so much, Brian and Deanna, for all that information. Moving on to updates from the Chief of Community Services, Mr. Lamont Daniels.
Thank you so much, and good evening, everyone. So, excuse me. So tonight, I'm really excited. As you recall, that all over the country, about 2.5, 3 years ago, the federal government provided funding for cities and municipalities to do a variety of things, specifically in the impacts of COVID-19. And through this committee and ultimately through the Common Council, we were allocated $2 million to support our mental health community, also to support housing, and also some job programs, which we prioritized based on the research and data that we were looking at 2 years ago. So I'm here tonight. There's still a few items in the queue that we're finally getting to. And tonight I'm really excited, especially the conversations that have been held over this budget year. And that's specifically, again, focusing on our young people, our young citizens of Norwalk. And Margaret Watt, who's representing the Norwalk Partnership, we have proposed back 2 years ago, so we already have the allocation. Tonight's purpose is to get approval for a weeks going contract to now to move this money into the Norwalk Partnership so they can provide pro-social activities to our young people. And so I would like to present Margaret Watt, who will be sharing the presentation, and also Anna Vivian Estrella, who you all know, our Human Services Director, who's been working with Margaret and also a member of the team. And then, we will then move forward for your consideration of moving this action item to Common Council for a vote so we can provide these critical opportunities and fun nights. Everything doesn't have to always be clinical and therapeutic, but we know that bringing people together in safe places to gather for our young people, which they have identified as a need. We're fortunate enough that we heard them. We interpreted the data to continue to move forward. So Chair, without further ado, I introduce Margaret Watt, who's going to do a presentation on how we got here and what the plan is for the $50,000 allocation that's already been approved. We're just now moving forward with the proposal process.
Just to be clear, we're just looking at a presentation right now. The action item we will talk about a little later in the meeting.
That is correct. Thank you, sir.
Correct. Okay.
Thank you so much, Lamont and Councilman Hoivelman. Is my screen being a little weird, or can you guys see everything?
Yeah, I see those squares, like black squares on my screen. I don't know what other people see.
Okay, hang on. I'm going to stop sharing. Let's see.
I know
You know what I'm gonna
technology
do?
don't want to work the way you want it to.
I've had this problem come up before. Anna Vivian is here. I'm going to share this to her and maybe she can share her screen. because she's part of our team and because I don't want to have this interrupt the entire flow. Anna, are you able to share your screen and have the same slideshow?
I should be able to. I'm going to pull it up right now.
Thank you so much. Sorry about this, guys.
That's fine. While we're sort of on hold, getting the tech worked out. We're going to hold after the presentation. We're not going to have any discussion at this point. We'll move into the rest of the meeting because we do have a member who's going to need to recuse themselves when we get into a discussion on this. But it's all right for them to be here for the presentation right now.
Anna, do you have it? I mean, did you get it? And I can start talking even if you're trying to pull it up, or
Yeah, I'm pulling it up right now.
thank you. Well, while Anna is doing that, I'll go ahead and, I think,
Yeah, I'm sure you know this. You know this. You know this.
I know,
Why don't
and
you
I
just
think you
start for the
guys,
sake of time.
right, and I also think you guys know me, but I should say I'm Margaret Watt. I'm the Prevention Director at Positive Directions, the Center for Prevention and Counseling. We're a local nonprofit. I am here as a member of the leadership team of the Norwalk Partnership, and I'm also a Norwalk parent and resident. And I'm very excited to talk to you about the Norwalk Partnership, or TMP for short, our proposal for a series of teen nights out. So to start, the Norwalk Partnership, I hope everyone is well aware of us at this point, but we are a citywide coalition of individuals and organizations working together to prevent underage substance use and promote youth mental wellness. The coalition represents, at a minimum, is required to represent 12 stakeholder groups. We have more than that, and we have just on the nonprofit community alone, we have about 30 nonprofits. Our leadership team includes Anna Vivian, me, Diamond Seed from the school-based health centers at HSC, Jim Martinez from the Norwalk Public Schools Cabinet, Ginger Katz from Courage to Speak, Danique Vitema-Lewis from Norwalk Acts, and Tori Sullivan, Health Department Chair at McMahon. So even at the cabinet level, or the leadership level rather, we represent a lot of different people and organizations working together. So one of the things that we do at TNP is everything we do is data driven. So it comes from the surveys, the youth surveys that I conduct here from Positive Directions, which are funded by the CDC Drug-Free Communities grant that I manage for Norwalk. And so our youth surveys, as I'm sure you know, have shown dramatically the influence of COVID on our teens. In June 2021, which was the survey before the one we did this year, 39% of all of our kids were depressed. The level of depression was much higher in certain subgroups. We looked at suicidal ideation. There was an impact on kids' relationships with their families, with teachers, and with peers. Fast forward 18 months, we resurveyed this year right around Halloween to see how things were doing. Depression has come down. It's not back to pre-COVID levels yet, but it's come down, which is in the good direction. Anxiety is now very prevalent, however, so are eating disorders and other mental illnesses. Importantly, kids reported that their relationships with friends, if they had friends, had improved a bit, not where you would want them to be, but only 50% of them felt connected to other kids at school. What we see, what we know, those of us who are parents, when you're in the schools, we see that the kids' social skills are delayed. Our survey this year also looked at what are they doing after school, because what are you supposed to be doing as a teen? You're supposed to be exploring your interests, learning to grow from childhood social skills and interests and awareness toward adult. They are spending many hours every week unsupervised alone at home. They are less involved in sports, in clubs, in volunteering and things like that than you would sort of typically expect. It's sort of an impoverished kind of and sort of younger group that we have at this point. It's all the impact of COVID. So with TNP, as we've been looking at the different things we can offer and what we can do for kids, we said, let's develop a Teen Nights Out initiative. The kids themselves are saying there's nothing to do. There's nowhere to go. How do you connect with others? You all know if you've got kids in the schools, there's no opportunity to socialize anymore. If you're at the high school level, it's just go, go, go. And so our Teen Nights Out initiative is really intended to be fun nights out for kids where they get to, you know, have fun, rebuild the social skills that they've lost, get connected to peers in a different way from what you might have in passing in school, and really just boost their mood, improve the level of depression. And all of that is also going to be in a safe, monitored, substance-free environment, because one of the things that happens is, you know, kids are at higher risk for using substances when they are depressed, when they're home alone, et cetera. So moving on to the, you know, what does a teen night out look like? It's basically as simple as it sounds. We're going to be organizing a series of events, ideally about 2 a month, for teens, primarily high school students who are the ones at higher risk, ideally primarily on Friday or Saturday night, because that gives kids something to look forward to for a couple weeks. Go out, do something, feel like you're a little more independent, more like a high school kid. And we are working with businesses. So this is kind of a public-private type thing. You know, we're negotiating discounts, in-kind contributions, et cetera, so that it really becomes a citywide initiative, you know, ideally funding from the council or from the ARPA grant, participation of many organizations in planning and organizing, and businesses contributing. This is just a sample of some of the events we've got going on. We are going to have a kickoff at the end of this month at the Hive in Sono, which is being contributed by various partners. We have negotiated a great deal with the Ice House and with Bullmore for some April activities that, you know, are tentatively planned pending funding. And you can just see a variety of types of activities. Moving on. What we're anticipating here is to have about 80 kids per event. Some may be bigger, some smaller, depending on the venue. Next slide, please, Anna. And we really, you know, the impact on COVID have been across all demographics, right? Across socioeconomic, across racial, ethnic, across everybody. But so we want to make sure that we are attracting a variety of kids. And so one thing we're going to do is have them in different parts of town: East Norwalk, South Norwalk, West Norwalk, different types of events. So some kids might be into a chess tournament, and some kids might be into Dungeons and Dragons, and some kids are singers or athletes. We have kids who are going to help promote this on social media and flyering in the schools. We have, as you can see, the third bullet, a number of groups that will help to promote it to teens directly, by teens, through the schools, to parents, on social media. We'll have lawn signs around town. So we're going to promote in a variety of ways. Kids will register for events online. We aren't going to make that a long process, but we want to make sure they're Norwalk kids. They'll show IDs to get in. It's an opportunity to gather a little data, like what part of town are you from? We'll kind of be touching base as the planning committee to see, do we see the same kids all the time? Are we getting different kids? Are there kids that we're missing and we're not seeing? What would attract them? And we'll ask them that question. So just to show you who's on the planning committee, these are all groups associated with the Norwalk Partnership, Positive Directions, HSC, Norwalk Acts, YBI, Triangle Community Center, huge partner for us because the LGBTQ community has the highest rates of mental health and substance and disconnection. So they're going to host a silent disco night for us, businesses, teenagers, etc. And just to show you, the intention really here is for the funding to go as much as possible to the direct event costs. And that's why we're trying to keep the costs low. For adult supervision, we have some people who are going to volunteer to chaperone. We have agency staff who can in some cases who can flex their hours and work at night but not get paid, or get paid as the normal whatever. We're going to have just some limited online advertising and lawn signs around town, and an administrative fee, keeping that minimal. And Wheels to You looks like they're going to work with us for transportation for kids if we've got like a group of kids from one part of town to an event that we need to figure out. So last but not least, the really basic metrics we're going to collect are just, what are we doing? Who's coming? How many different groups are contributing to this? In what ways? how much was the total cost and how much was contributed, and of course, feedback from the teens. So that's my brief summary of everything. I know you said, Councilman Hoivelman, no like discussion from the group, but if you guys have questions for me for clarification, I'm open.
Yeah, we can have a couple questions for clarification. Does anyone in the committee have a question? Anyone? No? I have a question that is more geared towards when does your next survey drop to sort of see how we're
It's-
doing?
Yeah, sorry. They're supposed to be every 2 years. This one, so the first one ever was November of 2018. So the
Right.
second one would have been November of 2020, where the schools were like, we can't do that right now with COVID. So it got pushed back to June 21, and that's why we're back on track now with the one we did this past fall. So the next
Okay.
one will be fall of 25.
Fall of 25. Okay, great. Does anyone else have any questions? No? Okay, we'll save any discussion we'll have in a little bit. Thank you very much, Margaret. It's a great initiative.
Thanks. Thanks so much, everybody. Have a good night.
All right. Mr. Daniels, is there anything else from your update?
No, sir. Thank you so much, Chair. My update was bringing forth this particular presentation as part of the community services update.
Excellent.
We just continue to serve our constituents with the community resource hub, and also our fair rent office. We are definitely serving our constituents, and I think we discussed at our next meeting, Anna Vivian will be prepared to just share some data so our constituents, residents know that when we made this shift for community services, these investments are really working and serving our community. So we look forward for next month to really sharing with this committee some data and some numbers now that we have Anna Vivian on board.
That's
Thank you, sir.
fantastic. We're excited to see that presentation. So moving forward into the action items, we'll start with the Health Department. Oh, I'm sorry. Diana, did you have something?
I'm so sorry. With the comments that I was just trying, my phone is being annoying and I'm part of that. I just wanted to say, can I say now part of my reasoning for excusing myself, or?
That's
Should I
fine if you'd
wait?
like to. We're not gonna,
Okay.
we're not quite there yet because it's it's number one under the community
Right.
services department.
Okay, I just wanted to, because exactly, when there was comments and you're saying if I have any comments, I wanted to say why I want to recuse myself, but it's for that. So I just didn't know if it's too early or wait. I'm so sorry. I just wanted to make sure proper
Yeah,
timing.
why don't we do the recusal right before we get into that action item?
I'm so for it. Thank you.
All right,
Thank
no
you.
problem, not a problem at all. So, Health Department, number one. This is authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary to extend the student practicum / internship agreement
Okay.
between the City of Norwalk Health Department and the University of Bridgeport. And I believe, Deanna, is this you?
Sure,
Great.
yeah. So
Thank
thank you. This is very similar to, if you recall, we had requested your approval to enter an agreement or extend the agreements with UConn Nursing and Fairfield University. And so now we want to also reauthorize or extend the agreement with University of Bridgeport and their nursing program to be able to offer opportunities for students to get, practical experience at the health department and also assist us. So very similar to those other two universities.
Great. Are there any questions from any member of the committee? None? Seeing none, I'm going to call for the vote. All in favor, please signify by raising your hand.
And I'll make that motion for you.
Oh, I'm sorry.
Chairperson.
I'm sorry. Thank you.
I do.
Councilperson Smith made the motion that I forgot to ask for. And so I'll call for the vote now. All in favor, please raise your hand by signifying aye. And any opposed? Abstentions? Motion carries unanimously. Moving on to the next item. So again, Health Department, item 2A. Authorize the mayor, Harry W. Rilling, to execute any and all documents necessary to apply for and accept grant funds from Optimus Healthcare Incorporated in the amount of $300,117 per year for contract period October 1st, 2022 through September 30th, 2027 for the Women, Infants, and Children WIC program. And I'm going to read 2B also because I believe these go together. It's authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary to implement the WIC program for a period from October 1st, 2022 through September 30th, 2027. Can I have a motion? Thank you, Ms. Councilperson Ayers, for moving that item. And I believe this is back to Deanna.
Great, so thank you again. So I'm gonna pass this update and explanation overview to Darlene Hoffler, who is our supervisor of clinical services. She oversees the WIC program. She's amazing, and she'll give you some updates about, what WIC is, who we serve, and so I'm gonna pass it on to you, Darlene. Thank you.
Thank
right.
you. Good evening, everybody. The WIC program is a federally funded supplemental nutrition program that services low-income, pregnant, and postpartum women, and as well as children from the birth to age 5. And the program's been housed at the health department for more than 40 years. The program staff provides nutrition education and counseling, breastfeeding promotion, and support nutritious supplemental foods that are culturally sensitive, and assistance with accessing community resources. They service about, on an average, 1,377 participants. Those based on recent numbers. Those numbers are up because maybe about 6 months or so ago, they were at around 1,100. So the numbers continue to grow. The WIC program partners with many other divisions in the health department, as well as several community agencies and programs to make available to their clientele any available opportunities, services, and programs that might be beneficial to them. They work on several goals throughout the year in accordance with Optimus, the ones that are established and administered by the state. It's a great program. We stay very busy, and if you have any questions, I'd be happy to answer them.
Thank you so much. Does anyone on the committee have any questions? Anyone? Well, Darlene, thank you so much for the work that you do with this, and just for administering this. It's a great program. I wish the federal government would give us more. So, but there we go. So with that said, I'm going to call for the vote. This is for items 2A and 2B, which are both related to the WIC program. All in favor, please signify by raising your hand. Aye. And any opposed? Abstentions? Motion carries unanimously. So both of those items will move, all three of those items will move to the next council meeting for council approval. Great. So now we're going to move on to the Community Services Department. And Diana, would you like to, before we get into this first item?
So I'm going to have to recuse myself because fortunately, although I'm a great believer of what's going on with this proposal, I'm part of it, and I'm very active in giving back to our teens of Norwalk. So, and this was an idea that came up with conversing with Margaret, myself, and Diamond. So I appreciate the council being able to speak and see to this. This is actually one of my heart's things to do. I'm actually even currently having some teams right now with me. So I'm going to recuse myself here, but I'll come back for anything if needed, or where you brought it to the end.
Okay, Councilperson Revoluz, thank you so much for that and for being a part of this. I think that's commendable for all the work that you do. So Councilperson Revoluz has recused herself from this discussion and vote. So this is Community Services Department, item number 1. And it is authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary with the Norwalk Partnership Positive Directions to serve as fiduciary to support Norwalk Teens Night Out in the amount of $50,000 total during the period of April 1st, 2023 to August 30th, 2023. ARPA account number noted. So can I have a motion? Councilperson Smith moves the item. And do we have any discussion? As we had the wonderful presentation earlier by Ms. Watt, and I don't know if there's anything else you would like to add, or Mr. Daniels, if there's anything.
Yes, thank you so much, Chair. I just want to echo again, this is our, on the city side, through Mayor Rowland, through the Rowland administration, this is our commitment to partner with organizations to ensure that while there are many other organizations, it was so important to Mayor Rowland that the city also make an investment to ensure that our young people, our children are also being served through these activities. And we're just excited again, as you heard in the presentation, the Norwalk Partnership is a coalition of many, many organizations, and they meet tirelessly and they meet to do the best that they can to serve our students and promote pro-social behaviors, and making sure that our young people are informed and educated of how to make healthy choices. So my department fully supports this particular program. We've also stated 2 years ago that this was going to be one of our priorities that you all have supported through this committee, ensuring that we make some significant investments to serve our students in the city of Norwalk. So I just like to say that we have made good in this commitment, and we're really excited to partner with the Norwalk Partnership to provide these fun activities in a safe and healthy place. Thank you.
Thank you, Chief Daniels. That's fantastic. Ms. Councilperson Ayers, you have your hand up. Go ahead.
Thank you. I think I just have a general question. I think one of the slides identified that you were going to do some type of advertisement to get adult chaperones, I guess, or adult assistants. With those people, first of all, did I understand the slide correctly?
Oh, you're muted.
Sorry, I just realized.
That's okay.
I don't know that we're going to advertise for adults. I mean, not advertise like paid advertisement. We have adults that we've lined up, and then we've reached out actually to school security guards to see if any of them, because they already know the kids. You might see a flyer from us going out, like not a paid ad, but like a flyer going out to community partners and parents and saying, would you be interested in chaperoning? Because we're not assuming it's going to be the same chaperones every time if there's like 10 events or something. Does that answer your question?
Yes, just thinking in a liability framework, not really necessarily with the school security guards, because they go through that background check, but I think it would be wise if you're pulling other people. I know not all public schools has a process for people to be cleared in order to work with students. And I think it would be wise to follow that same protocol. Even if this is not happening in a school setting, it could not, to err on the side of caution would not harm us. So I would offer that friendly suggestion to you. And secondly, I think in your presentation, if I heard you correctly, you spoke about the diversifying of the activities so that different students with different interests would be able to find something, maybe not this month, but maybe next month, find something that they were able to participate in. And I was very happy to hear that, as we have a very diverse student body and they all kind of like really, really different things. But I was also wondering if I'm understanding, when this was originally allocated, it was to make sure not only that we provide the service for the teens in the city, but that we're also reaching teens that may not have been reached in different ways before. And you may not have this answer tonight, Margaret, and that's absolutely fine. But how are you in the partnership going to dumb down on that data enough for us to have a tangible number or a tangible list of those kids who are not being engaged?
It's such a good question. We've been trying to talk about like, how do we make sure that we're getting kids who haven't been engaged? And at the same time, also looking at it and going, but do you also want to kind of like ding the kids just like, oh, you happen to be engaged in an after school program and you've never had a thing to do on a weekend night. So there's like that balance of like catching kids who maybe are disconnected completely, and then also not saying to other kids, well, you can never go to one of these events, right? So we don't have a full answer to that. We're looking, you can see that we've got our first 3 activities kind of planned out. Part of it is, I think, really, we've talked like to the teens that we have in school, and we're trying to make them aware, like, you know, especially at this age, there's like the kids who don't know anyone and are disconnected. And also there's that teen factor of like, is it cool to go to this? Is anyone else going to be there? So we're trying to identify students who are really leaders, who are like, who's going to be like that wraparound? Like, hey, you come with me. Have you gone to this before? That kind of thing. But we're talking with health teachers. We're shorter answer than what I'm doing here is we want to look intentionally with the people who know the kids, who's coming, who's not coming. And then do we like try to tailor activities where there's something that's just like, hey, this is for kids who like, you know, here's a mixer, want to make new friends, feel like you don't know anyone, like the advertising language on the flyer, maybe sometimes is going to be really kind of making it sound like if you don't have anyone, come to this.
I think that's all fine. I think I would just offer a suggestion to really utilize those SGCs in the schools and those PTAs in the schools. Not necessarily, they might not recruit for you, because if my mom says go to a party, I don't know if that's a party I would want to go to.
Right.
But sometimes those bodies are aware of other children who are not necessarily in the group with the, you know, the group of kids. And so at least they could say to someone, hey, did you hear about that? So I just think that that would be another resource for you to use. Is as many people who know about it maybe can speak about it. Thank
I
you.
love that. Those 2 ideas are terrific. Thank you, Counselor Ayers. And I would say too, NPS Communications will also send out a flyer directly to parents for us. And so that one might be a little clearer in some cases where we're like, hey, parents, you know, because the parents might know that their kid doesn't know anyone and is disconnected, and they might push their kid to a specific event. But thank you for the liability, I think too, that's important.
Thank you. I have a quick question that sort of following up on this. Are you engaging the school counselors as well and social workers as part of the sort of process of identifying?
So that's a good question. So that's where Jim Martinez, who's part of our leadership team, oversees all of them. And so that's another way of kind of trying to target, you know, not target like, hey, we want you to come to this because we think you're at risk, right? But like just making sure that information gets to the right people and they're kind of encouraged to come to things. And I think, and we're hoping that like the first 3 events being kind of just big fun events will kind of create some stir, and kids are like, oh, that was really fun. And so you know, if we can create interest in it in general, and then we have like some targeting of certain kids, that will help.
Councilperson Smith, you have your hand up.
Yeah, I just want to say how really terrific this is. You know, I think back to when one of my kids was young and he was in high school and even in middle school, always looking for something to do. You know, like my daughter was super involved in like the music department at Norwalk High. She was always really, really involved and really busy, but my second one, not so much. And I would have to drive him to Danbury. There was some underage music venue where they could go and listen to music and, you know, have sodas and stuff. And there was also a little place in Westport that they went to, but there was nothing here, you know, and it's, you know, with our kids so disengaged now, I just think this this is really, really terrific. And I just want to commend you all, the whole partnership for the work that you're doing on this, and to Mr. Daniels for, you know, you bringing this to the committee a couple of years ago, you know, so it's terrific. I think, you know, one thing that I'm thinking of that, you know, that question is it cool? Is it cool to go? I mean, as long as it's not at school,
Yeah.
I think it's pretty cool, you know? So, and I think that it will draw kids, and you know, there's been a great deal of discussion about how to reach those kids who are unengaged. So I don't need, you know, I don't feel I need to comment there, but this is just absolutely terrific. So thank you so much. Our kids really need it.
Thank you for saying that. And if I can just add a quick comment, when you talk about those, like to driving your kid to these like social activities that were somewhere else, this idea came about in our alcohol committee when we were talking about the needs. And, you know, Diana, who is recusing herself for this reason, she and I were like, we used to go to the underage dance nights in Stamford back when we were in school. And I'm older than she is, obviously, but that means in our years, we had that option. Like, we don't even have a YMCA, right? Towns around us have teen centers. So Norwalk just really has this lack. And the kids always say there's nothing to do by the time they're in high school, because how many times are you going to go to the aquarium, and that is not a place to go when you're like 18?
No, it's not. It's not. I mean, I'm really dating myself here, but it was the roller skating rink for me, you know, and for all of us. We would just go there on a Friday night and, you know, hold hands with our boyfriend and skate around. You know, it's just, we really, really need this. So it's great.
Thank you, Councilperson Smith. Yeah, I just want to add that I'm really glad this is happening, and it's going to be a part of the cadence for the city of Norwalk. I think it's something that our youth need. And, you know, to echo Councilperson Smith, I was a roller rink kid myself as well. That was it. My parents would drop me off there on a Friday night and pick us up later. And, you know, it was something we had to do, and that was available to us. And I think that's important, that we're trying to find these things, especially right now. Councilperson Meek, you have your hand up.
Oh, no, I was just curious. Are you talking the roller rink that was on Merwin Street over off Commerce?
Oh, I didn't know. My roller rink was in Twin Lakes, Illinois. So that's where it was.
Yeah, mine was in Johnstown, Pennsylvania.
we right where the Waypoint is. We used to have one years ago. I mean, it went the way those things went, but that was a lot of fun growing up when it was the thing to do. That would be nice to have one of those back.
Yeah.
Yeah, we had a disco ball, right?
There we go.
Going down memory lane.
All right, memory lane. Are there any further questions for Chief Daniels or Ms. Watt? Seeing, oh, sorry, go ahead.
No, just Chair, I just also want to acknowledge, you know, in the spirit of just acknowledging the team effort, Anna Vivian, our Human Service Director, who we know she's here with us. She really has taken this vision that, you know, I still remember meeting Councilwoman Barbara Smith, and I said, I have some ideas here. So I always get excited when, you know, over the years, they're starting to come fruition. And now having Anna Vivian with us, she has just taken the charge and works very closely with Margaret. And so, you know, so thank you. And I want to thank Anna Vivian for her leadership and now providing that support to move these important, critical initiatives forward. And I think we all agree our children are very important to our society and our community.
Yes.
So thank you.
All right. So with no further discussion, I will call for the vote. All in favor, please signify by raising your hands. Any opposed? Abstentions? And motion carries unanimously. And Ms. Revolus, your timing is perfect. We are moving on to the next item. Number 2, authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary to extend the after-school partnership extension agreement with the Norwalk Housing Authority beginning July 1st, 2023 through June 30th, 2026. May I have a motion? Thank you, Councilperson Ayers. It's so moved, and I believe, is this Mary Oster going to speak to us about this?
That is correct. Mary Oster is going to lead us, Chair, and then I'll add some commentary.
All right, hi, Mary.
If needed.
Hi, everybody. So and I apologize for the barking dog in the background. It's what happens when we're at home, I guess. So back in 2021, the Norwalk Housing Authority needed to license all of their after-school programs. And that at the time there were two sites that were not able to be licensed, being King Kennedy and Meadow Garden. So the idea was that the city would be able to kind of vouch for them. And the intention was that those would both move to 98 South Main to the former South Norwalk Community Center. In the intervening time, Meadow Garden was closed, and they're using it as an arts center or something, I don't know. But anyway, King Kennedy is still open and operating. As you probably all know, I don't know the particulars, but 98 South Main is no longer available as a site for an after-school program. And so they are trying to figure out another plan, and they're coming again. The agreement was to run through June 30th, 2023. And so now they're requesting an extension of that agreement through June 30th of 2026, so that they can determine another plan for the children who are attending the after-school program at that site. I will tell you, for those of you who don't know, it's a very small place. They have capacity for about 20 kids. They are following all licensing regulations. So that means that there's a certain square footage. So they can only accommodate a particular number of children. And it just, because of that small number of kids and the cost to really get it up to where it could be licensed is just, those things are so far apart. So really, ideally, they will be, I don't know, they're working on a plan because they know that because when 98 South Main fell through, they have to come up with some other alternative plan for that center. And so they're asking for that extension for 3 years. Any questions?
Okay, does any member of the committee have a question? Any questions or discussion? Mr. Meek.
Yeah, just keeping in line with prior practice. I'm voting no on any new incremental spend for the city. I will continue to vote for grants and allocated grants to the city, but anything that's new out of our local budget, I am voting against until, and not this committee, but until all the committees get their act together on providing hybrid meetings with consistency and quality. And so that's my position. I just want to let you know, don't take any offense to my upcoming no vote here.
All right. Go ahead, Chief Daniels.
Chair, through you, just want to clarify for this particular authorization, we're not asking for any funding.
I may have been ahead of myself. We're on item 2.
We're on item 2, yes.
Okay. Forgive me. That's applies to item 3.
Yeah, this is just to extend the after-school partnership agreement with the Norwalk Housing Authority.
That has my yes. That has my yes.
No, sir, no cost.
No cost. Again, is there any other further discussion? If not, I will call for the vote. All those in favor, please signify by raising your hand. Aye. Opposed?
Thank you very much.
Abstentions? Motion carries unanimously. And moving on to, thank you very much, Mary. Appreciate it.
Thank you, Mary.
And for all that you do. It's wonderful. Item number 3, authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary with Emily Melnick Consulting LLC to perform strategic planning, consulting, consulting services to Norwalk Community Services Department in the amount of $10,000 total. Family Navigator grant account noted, $8,437.50, and fair rent account noted, $1,562.50. May I have a motion? Councilperson Smith, thank you very much. And I believe that we have Chief Daniels
Yeah,
to speak
this
to us
will
on
be
this one.
me.
All right.
Thank you again, Chair. And I have accompanied some documents regarding this particular action item. I'm just really excited. One of the things that Mayor Rowland has really promoted is that you all recall we made a significant investment in the efficiency study to really look at our procedures, our practices, and how we operate as a city, specifically through our departments. And one of the recommendations from my department was really to look at how we function as a department. Just want to remind you that we are a new department. This department has been formed in 2019, but then several months later, COVID hit us. And so it was all hands on deck. But in the efficiency study, the consultants really called out that it would be critical that as we move forward as this new department, through the health department, human services, and library, that we develop, I use the word strategic plan very, very loosely, but it's really common goals, common practices. So we're not operating individually in silos, that we just have these departments that work together. So we can look at how we function. We can look at how we collaborate and partner. And one example is, for those that have been here longer than I have, that even in the health department, when the social services department was dissolved many, many years ago, there were some functions that were in the health department. One example that I highlight all the time is the health department was overseeing our senior services contract. And that's not where it should have lived, but recognizing that it had to live somewhere, again, which really supports this investment and the needed change for our restructuring of our government, which now is under my leadership. And so this particular action item will speak specifically to one of the top prioritized recommendations from the efficiency study, really causing us to look at ourselves now that we have a reprise, as you heard in Brian's report, to really how we function, looking at the opportunities. We've made some significant investments with our community resource hub, our family navigation program, Sherelle's leadership of using the librarians as reference specialists, specifically around some of those services. But we really need a plan, a vision, and it needs to be written out. And so tonight I have before you is that next step, again, as identified and recommended from the efficiency study. And then lastly, I think what is exciting to me, we received grant funding for our family navigation. That's actually how the family navigation was brought for us. It was 100% funded by grants, and it still continues to be that today. I think it's around 70-30, 70% the city and 70% grant funding and 30% our city. And so as you can see, our funders, the Ritter Foundation and the Parent Asterisk Foundation, they have been quite impressed of our work, how we're serving our residents, and has granted us money to then look at our entire department, and that's an investment. So you can see 8,400 of it, I'm rounding off, I know I got a whole bunch of papers in front of me, that's a grant. So that is not city taxpayers funding. The city amount to have this process go forth is only 1,500. So I'm asking tonight for your consideration to move forward so we can bring Emily on board. I failed to mention that Emily has been the consulting for the Family Navigation Program, and Emily has also been the consulting for the Health Department. She understands Norwalk, she understands our work, and having her on board to then look at us from like a eagle's view, if you will, or at how all the other departments, I think it would just only really support how we operate and how we serve our constituents now that we are formally one department, which the Community Services Department. We've already made the org chart changes that were recommended by the, as you can see in your documentation from the efficiency study. And this is just kind of phase 2 of making sure that this document just doesn't sit on a shelf and we don't act to serve our constituents better. Thank you.
Great, thank you, Chief Daniels, for that explanation. Councilperson Nicole Ayers.
Thank you. I would like to say to Chief Daniels, thank you. One thing that I've been pushing is the actual use of the efficiency study, and for us to really analyze how we are doing in the recommendations of the efficiency study. So for your department to really be spearheading those efforts, I thank you so very, very much for doing that. I thank you on behalf of all of our citizens who really look to any public administrator to be not only efficient, but also responsible when we have these type of documents. So I just like to say thank you for all of that.
Thank you.
Thank you. Anyone else have any comments or questions for Chief Daniels? Seeing and hearing none, I will call for the vote. All those in favor of moving this item to the council, please signify by raising your hand, aye. And opposed? Abstentions? That would be all in favor except Mr. Meek, who voted no. So motion carries, and we'll move to the next council meeting. And I believe that is it for tonight.
Motion to
So
adjourn.
there we go. Knew that was coming. Thank you, Diana. All in favor, please signify by raising your hand. Any opposed, abstentions, motion carries. Thank you all.
Thank you very
Have
much.
a lovely evening, and
Good night.
hopefully spring is here.
Thank you very much.
Good night,
Have a good night.
everybody.
All
Bye-bye.
right, bye-bye. Feel better, Anna Vivian.
Thank you.
Bye-bye. Have a good night.
Mom.
Thank you.
Yes,
Thank
ma'am.
you.